In the United States today, the number one killer, despite all of our medical advances and all the things we have to offer people, still is cardiac disease. And cardiac disease nowadays is understood a little bit better to include not just the heart, but also all the other arteries and veins that are connected. So when we refer to cardiovascular disease, we're really talking about the heart and all of its associated plumbing. Well, men and women both, the highest cause of death in America is heart attack. I think a lot of times the female side of that story gets lost a little bit, and it's worth restating. Folks in our country need to be aware of a number of different things if they're concerned about these types of problems. Certainly you always hear about chest pain, but just one word on the symptoms that oftentimes go along with the heart. There are typical symptoms, but most people don't have typical symptoms. It's not the crushing pain in the middle of the chest. People have a variety of symptoms. It can be pressure, it can be a dullness, it can be an ache in the jaw, the shoulder, the back, the arms. It can be shortness of breath, and I think importantly to understand, there can be no symptoms at all. About 30% of the population, once they reach the age of 65 or older, for a variety of reasons, will have no outward signs of coronary disease. So all this highlights the need for taking care of yourself and being aware. Risk factors for heart disease are the same as for stroke. They're the same as for vascular disease involving the other arteries of the body. Smoking. If you smoke, quit. If you can't quit, get help. That's probably the most important thing that you can do for your health. Diet and exercise cannot be overstated in terms of their importance. Proper diet and regular exercise are important to the recipe of maintaining cardiovascular wellness. Diabetes, blood pressure, and cholesterol are the other three that go along with this, and proper maintenance of those entities and proper care of those is really essential to curbing the natural progression of cardiovascular disease. If you by chance have chest discomfort or you're having symptoms that make you wonder if I have heart disease, you do need to seek medical attention. It seems obvious, but I can't tell you the number of patients over the years that have waited and tried to blame it on something else, partly because they either didn't want to believe they had heart disease or they didn't want to inconvenience their otherwise busy lives. But chest pain is nothing to mess around with. It's something that needs immediate attention. If you're having a heart attack or think you're having a heart attack, the best thing you can do is get to a hospital as quickly as possible. And that really should not be you driving the car. That should be a 911 call, and that should get you to a hospital as quickly as possible. The reason that's important, aside from the obvious you shouldn't be driving with a heart attack piece, is that the quicker you get to the hospital, the quicker you can be treated, and the quicker we can make your heart well again. There's a very critical time period between when you start to have a heart attack and when that heart attack is treated. And the quicker that we can get you to a facility like ours that can treat this properly, the quicker the heart attack can be terminated and normal blood supply can be returned to the heart. At El Camino Hospital, we are the first chest pain accredited center in the Bay Area. And what that basically means is we've gone through all the necessary and appropriate mechanisms to make sure that when our patients hit the door at this hospital and come to the emergency room with a heart attack, we have all the systems in place to treat them in the fastest, most effective way possible. Typical experience is once somebody hits the door at the emergency department, an EKG is done immediately if it wasn't done in the field and transmitted to us ahead of time. We have an alert system that gets all the right personnel in place, and patients are rapidly moved into our interventional suites where we can diagnose the problem with an angiogram and treat the heart attack with angioplasty and stenting. Hospitals and physicians, for that matter, are judged by how quickly and how expertly they can perform this, and we try to get from the door to the balloon, if you will, to the point that the arteries open again as quickly as possible. National standards shoot for about a 90-minute time period. Our internal goals here at El Camino are 60 minutes, and I can tell you that routinely we beat that number significantly.